While coronavirus does not discriminate, some claim that healthcare often does. News 19's Candace Price is digging deeper into the history of policies and practices considered racist in the healthcare system and how our very own local medical professionals are pushing for change.
Doctors are sworn to do no harm, but apparently not all patients are being treated equally.
I think it's still very saddening that I go to the hospital and that I have people that are my colleagues even discriminating against and making me or trying to making me feel bad about being a minority.
Dr. Tellez, a physician at UW Health, knows all too well the discrimination that can take place in the hospital room.
It makes a difference when you are working with people that you think are college educated, and even then they discriminate against you, your own colleagues in the hospital, patients that do not perceive you as a qualified person just because you are from a different place and you have an accent.
The CDC's most recent report shows Black people make up 22% of coronavirus cases in the U.S., Latinx people 33%. In Wisconsin, the number's equally grim.
The disparity in Wisconsin is wide, 6% of the state representation and 26% of the deaths. So what this pandemic is doing is highlighting the fractures we know exist.
Doctors at Mayo Clinic point to systemic racism and discrimination as one reason why minority communities are more vulnerable to a range of health issues, including the coronavirus.
We want to reduce the known disparities in cancer diagnoses, outcomes, delayed diagnosis of cancers in particularly Black women and in Hispanic or Latinx populations.
The history of medicine plagued with examples of racism.
From the way slaves were used in medical testing unwillingly, to the government's Tuskegee experiment, to the lack of inclusion of research to address major medical problems, to the lack of representation.
To the point of representation, according to the CDC, less than 6% of U.S. doctors are Latinx, Dr. Tellez among them.
It is difficult as a minority to be in a place where I am the only one, and I'm the only one most of the time advocating for minority communities, not only Latinx, but every minority community that we serve.
Dr. Tellez says she feels a responsibility to advocate for patients of color.
Once we get to the hospital, we need to have people that are ready to work with us, language, culture, discrimination-wise. So we need a lot of training, because obviously by the time we have enough health professionals that are able to fulfill the needs of the community, we need the community at large to also be ready to work with us.
All of the doctors we spoke with agree that the larger systematic issues of racism must be addressed first before it can be addressed fully within the overall healthcare system.